Welcome to today's video of ANAT-AV. The bone we will be discussing today is the scapula, including its side determination, features, attachments, movements, and its applied anatomy. The scapula is a flat triangular bone situated on the posterolateral aspect of the thoracic cage, extending from the 2nd to 7th rib level and contributing to making the shoulder girdle. Side determination. The glenoid cavity lies laterally and superficially. The dorsal surface is convex and divided into two fossae by the spine. The costal surface is concave. Therefore, this is a left scapula.
Features of the scapula. The superior border is thin and short, and the suprascapular notch is present near the coracoid process. The lateral border is clearly defined and widens into the infraglenoid tubercle at its upper end. The medial border is slightly thickened and extends from the superior angle to the inferior angle. The costal surface is occupied by the subscapular fossa and 4 or 5 longitudinal ridges. The dorsal surface contains the spine of the scapula, which divides the surface into the supraspinous and infraspinous fossae, which are connected through the spinoglenoid notch, which is lateral to the root of the spine. The superior angle is at the junction of the superior and medial borders, whereas the inferior angle lies over the 7th rib or intercostal space. The lateral angle bears the shallow glenoid fossa, which accommodates the head of the humerus. The spinous process is triangular and its posterior border is called the crest of the spine. The upper and lower edges are roughened for muscle attachments. The acromion process is at the lateral end of the spine and has an oval facet for articulation with the clavicle. The coracoid process is directed forwards and slightly laterally.
Muscle attachments. Subscapularis arises from subscapular fossa. Serratus anterior is attached near the inferior angle into a narrow strip on the medial border of the costal surface. Long head of triceps brachii to the infraglenoid tubercle. Long head of biceps brachii to the supraglenoid tubercle. Supraspinatus muscle is attached to the medial 2/3 of the supraspinous fossa. Infraspinatus arises from the infraspinous fossa. On the dorsal surface of the lateral border, the upper 2/3 is occupied by teres minor and the lower 1/3 is occupied by teres major. Levator scapulae is attached to the medial border from the superior angle to the root of the spine. Rhomboid minor is attached below this, opposite the root of the spine. Rhomboid major to the medial border below the root of the spine. Related ligaments. The capsule of the shoulder joint attaches to the glenoid neck at a variable distance from the glenoid labrum, which is a fibrocartilaginous rim around the glenoid fossa. Coracohumeral ligament is attached to the base of the coracoid process. The coracoacromial ligament is attached to the lateral border of the coracoid process and the tip of the acromion process. The superior transverse or suprascapular ligament converts the scapular notch into a foramen which contains the suprascapular nerve. Coracoclavicular ligament connects the clavicle and the posterior part of the coracoid process.
Movements of the scapula. The movements are protraction, retraction, elevation, depression, lateral rotation, and medial rotation. Applied anatomy. Winging of the scapula occurs due to paralysis of the serratus anterior. Here, the medial border becomes unduly prominent and the arm cannot be abducted beyond 90 degrees. Fractures are rare because of the strong, thick covering of muscles protecting it. It only occurs due to direct and severe violence. Scapular anastomosis has two subanastomoses. One around the body of the scapula, made by the suprascapular artery, deep branch of transverse cervical artery, and the circumflex scapular artery. The other is over the acromion process by the acromial branches of thoracoacromial, suprascapular, and posterior circumflex humeral arteries. These anastomoses help in collateral circulation when there is a blockage between the first part of the subclavian artery and the third part of the axillary artery. That brings to an end this video on the anatomy of the scapula. If you enjoyed this video and found it helpful, don't forget to like, comment and subscribe. Please share this video with your friends and anyone interested in studying anatomy. Thank you for watching ANAT-AV.